Hello, it's Dr. Rhonda Johnson. Today is Monday, September 18th, 2023. And did you know that September is National Suicide Prevention Month? It's not an easy topic to discuss, but it's an important one. And also, I want to say that this message is for information only. I'm not giving crisis advice. Please always consult your medical provider for your health care needs. Now, the data is clear from the CDC. They recently released a report in April that from the period of 2001 through 2021, suicide rates have increased most years for both males and females. And I'll include the link to the report. So what is causing this increase in suicide? Well, first of all, you have to know there's no single cause for suicide. Suicide can be the result of a total loss of hope and a pervasive feeling that things will never change. Now, there are some risk factors that you can identify. So, for example, bullying in youth, and it varies by age and demographic group. But studies have shown that youth who report bullying others, as well as youth who are victims of bullying, are at an increased risk of suicide. Also, untreated mental health conditions such as depression, anxiety, substance abuse can increase the risk of suicide. Unemployment can be a risk factor for some adults, and a diagnosis of severe physical illness may be associated with a higher suicide risk. Now, again, that's just a partial list. It is by no means complete in terms of risk factors for suicide. Now, the International Association for Suicide Prevention website has, I think, a lot of very useful information. One of the most important things that I want to say is help is available. If you're considering suicide, please speak to someone today. In the United States, we have the National Suicide Prevention Hotline. All you have to do is text or call 988 and you will reach a trained counselor. It's free. It's available 24/7. Information is available in English and Spanish. Or if you want to do an online chat with somebody, you can go to 988lifeline.org. Or you can always call 911 if you're in immediate danger. Now, from this website I mentioned, the International Association for Suicide Prevention, I found that one of the things that they talk about is how to support someone in a suicidal crisis. And they mention that when someone tells you that they're suicidal, you have to take them seriously. And if you feel comfortable talking to them about it, you can say, using clear and direct language, I care a lot about you. Do you feel suicidal? Research has shown that talking to somebody about suicide openly does not increase their risk of suicide. Now, people who have tried to commit suicide have often expressed how helpful it is to have someone who listens, just to have somebody to talk to. And they say it's not about coming up with solutions, but about listening to the person and supporting them help explore options for seeking help and safety. So that's my message today. It's a difficult topic. You can't cover it in a few minutes, but there are resources to get more information, and I'll include them, the links. Take care, folks, and be safe and be well.